Hello everybody and welcome to another episode of Ask Dr. Bob, and very phenomenal questions today, so let's get right to it. Dr. Bob, this individual has Hashimoto's. Her maternal grandmother had it and another grandmother had it, and she wanted to know if it's genetic or not. Let me talk to you a little bit about these conditions. A lot of times, and I've seen this happen in family members that come into our practice, you could follow actually the same lifestyle patterns that your family does, whether it be eating or what you associate yourself with. So just to break some of these patterns, commonly with Hashimoto's, we always say follow the numbers. There's a lot of controversy. Do you take iodine or don't you take iodine? So we always look at the TSH, the T3, the T4, and the TPO, and we treat accordingly. When it comes to Hashimoto's, stay away from gluten, because gluten is going to basically handcuff your body's ability to absorb minerals. And I've seen parasites with Hashimoto's. I've seen a variety of challenges. I'm not saying it's not genetic, because obviously there are patterns, but always look to see what everybody is eating. Stop gluten. We also use selenium and a liquid vitamin E to help our practice members with Hashimoto's. Now this individual is having gallbladder challenges, and the surgeon, of course, wants to take, or the family doctor wants to have the gallbladder taken out and wants to know if there's anything naturally that we could do. And I just had someone this past 2 days ago that had high liver enzymes, had high bilirubin, had a high white blood count, and we were able to create a strategy to help prevent that. In less than 3 days, her gallbladder symptoms were reduced and minimized. One of the primary products that we use is phosphatidylcholine. Here's a question about somebody who has a pregnant sister, went for her prenatal exam, she was tested for HIV, but her husband had the same test and it was negative, and she was confused. Well, I want you to know that I am not an HIV expert, but I do know that a person's immune system can be compromised, allowing certain conditions to occur in someone. It's kind of like you could have a family member that has allergies, but another family member does not. So what is it? Is what they're eating? I wish I could give you a safe answer for the why, but the husband may have an immune system that has not been compromised. Dr. Bob, what would you recommend for Parkinson's disease? Well, I want you to know that, not that we've cured Parkinson's, but I know from my experience, phosphatidylcholine, which is a product that we use that helps that liver, gallbladder, and that whole brain mechanism function better. Dr. Bob, my hands go numb, and I don't want to have surgery, and they think I could be a diabetic. Well, you could easily rule out a diabetic through some blood tests. And what I would suggest that you do with your hands being numb is start working on doing some head slides. Or when you're driving down the road, push your head against the headrest, lay backwards on a large ball, a 65 centimeter ball, about 3 to 5 minutes every day. Dr. Bob, is there any advice that you could give to a person to maintain sobriety? They also are healing with liver edema and hepatitis B. We have learned that most people that have some issues with addictions we use a vegetable-based lithium. You can contact our office for that, called L-Lyzyme. We also use milk thistles, probably the best to help with any kind of a liver issue. Dr. Bob, and this is my last question, they live in Hawaii, they've been to the same pediatrician in Hawaii. Now this pediatrician will not see them unless they get vaccinated. You know, we've had the same thing happen here in Ohio, and first, to the best of my knowledge, here in Ohio, you can't keep a kid from going to school because you could write it off as a personal religious faith-based reason you're not getting vaccinated. And I'm not saying this to be silly or not. You know, I'd get another pediatrician. There are pediatricians that don't require vaccinations. Yes, I understand you live in Hawaii. Fly to a different island. I'm not exactly sure what you need, but I know in our practice we see people all the time that get healthy and stay healthy without vaccinations. And here's an interesting statistic. The flu vaccine for 2015 was only 19% effective. That means there are people that were losing their jobs because they wouldn't get a flu shot. 19% effective. So I don't propose that vaccinations is a very wise activity to pursue. I'm Dr. Bob DiMaria, the Drugless Doctor.